Hello, good afternoon, everyone. Today we will be talking about diabetes education series 1. So there will be 2 series for this diabetes education. And today we will be sharing about reversing of pre-diabetes. So we will have staff nurse Mushin and staff nurse Rui Hao who will be sharing us for today's health talk topic. So in any case, if you have any questions along the way, you can feel free to type on the chat box, or otherwise we have a Q&A session at the very last section. So you can actually on your mic and share with us later. Okay, passing over the mic over to you, Mushin and Rui Hao.
Hello. Okay, everyone can hear me, yeah? Okay. Hello, good afternoon, everyone. My name is
Hi, good
Mushin.
afternoon.
Cool. Okay, hello and good afternoon, everyone. My name is Mushin, and this is my partner, Rui Hao. We are from SGH Community Nursing. Today, we will be sharing with you all about stop and reverse pre-diabetes. Okay, so this is what we are covering for today. What is diabetes? The different types of diabetes, causes and risk factors, signs and symptoms, complications, treatments that are available, and self-care that I can do. Okay. Next. Hold on. Okay, before. Hello. Hello. Before we begin, let me ask a few questions to get an understanding from the ground. Diabetes is contagious. You need to be careful. True or false?
False.
Anyone else? Make a guess. Okay.
True.
Okay, so the answer is false. Diabetes is not contagious as it is a chronic disease. Okay. The next question. Okay, diabetes is caused by eating too much sweet food. True or false? Can anyone make a guess?
False. False.
Okay, anyone else? Okay. Okay, it is false when our body doesn't produce enough insulin, as our body is unable to cope with this high sugar, which can lead to diabetes. Okay, all right. Okay, next. So what is diabetes? So diabetes is a condition where our body is unable to manage sugar properly, which results in too much sugar in our blood. When this happens, our blood sugar level will remain persistently higher than normal. That's diabetes. Okay, can you make a guess? Are there different types of diabetes?
Yes.
Anyone? Yeah, at least these are some of it. Okay. Okay. I can see some answers from the chat. That's good. Okay, all right. Thank you for sharing. So there are 3 types of diabetes. Okay, type 1 diabetes, type 2 diabetes, and also gestational diabetes. Okay. Okay, before I touch on the different types of diabetes, let me explain what is pre-diabetes. So before people develop into type 2 diabetes, almost all pass through the stage of pre-diabetes where your blood sugar levels are higher than normal, but not high enough to be considered as type 2 diabetes. So having pre-diabetes means that you are likely to progress onto diabetes in the near future. It's like a warning sign. And studies have shown that a few lifestyle changes, such as adopting a healthier diet, regular exercise, and maintaining a healthy weight, can reverse pre-diabetes, as well as reduce the risk of type 2 diabetes. Okay, there are no clear symptoms of pre-diabetes. The only reliable method of diagnosis is by having blood tests done. And if you are 18 to 39 years old, and want to have a check for diabetes, you can use the diabetes risk assessment, also known as DRA. And if you are 40 years and above, please see your doctor for health screening, including diabetes. Do visit screenforlife.sg for more details. The DRA, which is known as the diabetes risk assessment, can be found there. Okay, now touch on type 2 diabetes, which is a common type of diabetes. So type 2 diabetes is caused by the body not producing enough insulin, or the insulin is there, but it's not working properly. Hence, the blood sugar level is high. So type 2 diabetes is usually found in people 40 years and above, those who are overweight and physically inactive. In some people, the condition is mild and they're able to control their blood sugar with just diet and exercise. However, if the condition gets worse, they may require oral medications and also insulin injections in addition to make their lifestyle changes. For those who are overweight or obese, losing weight can be significantly beneficial, even if it's just a small amount. Okay, so the other types of diabetes is type 1 diabetes and also gestational diabetes. For type 1 diabetes, it usually occurs when the pancreas loses its ability to produce insulin. It's usually present in children and young adults, but can also present in older adults as well. Usually it's inherited and cannot be prevented. There's no insulin produced due to the damaged pancreatic cells. Usually the individual may need insulin injections for their daily livings. Complications are sudden and may be life-threatening. And for gestational diabetes, it's usually happen to a pregnant lady because due to the hormonal changes in pregnancy, some women may show high blood sugar levels during their pregnancy. These women may require specialized obstetric care to prevent complications to the unborn child. In gestational diabetes, the blood sugar levels can return to normal after delivery. However, these women may be at increased risk of developing to type 2 diabetes later on in their life. Okay, these are statistics from studies which shows that diabetes is a common and serious condition in Singapore. As you can see, 1 in 3/3 of Singaporeans is at risk of developing diabetes. 1 in 9 Singaporeans has diabetes. And 1 in 3 individuals with diabetes does not know that he or she has diabetes. Okay, this is what happens in a normal person. Hold on. Okay, so food that we eat become glucose, also known as sugar, and enters our bloodstream. Then blood glucose level goes up. Insulin, a hormone made from the pancreas, acts as a key and unlock the body cells to let in the glucose. Glucose then leaves the bloodstream and enters the cell. Blood glucose level then return to normal. Then the cells turn glucose into energy. Okay, moving on. Okay, so blood sugar level increases when we eat food that is rich in sugar and refined carbohydrates. These are some examples of the kinds of food that increases our blood sugar. Okay, such as kueh, prata, white rice, fruit juices, sweetened beverages, and also white bread. Okay, so when high blood sugar levels, it causes our pancreas to work harder, and this will overwork our pancreas and causes stress, fatigue, and eventually damage our pancreas. And when our pancreas are damaged, it decreases hormone and decreases in insulin production. Okay, so what happens when there's too much sugar? Okay. So those sugar that is not utilized will eventually be excess sugar that is stored as fat, as you can see from the slide. So fat will surround all our organs and muscle, and also under our skin. Right. And as you can see from this slide, okay, a healthy person, difference between a healthy person and a person that has too much sugar in the body. You turn as fats. The fats will surround all our organs, and this will cause us to have high blood sugar, high blood pressure, and also high blood cholesterol. Okay, from this slide, you can see the green box on the top, see a healthy organs, will result in normal insulin level and also normal blood sugar level. But then you can see from the red box, when all the fats are covered in our organs, it will cause our pancreas to produce less insulin, and it causes us to have high blood sugar level. Okay, so diabetes can affect anyone. So it's important to identify the risk and the changes that we need in our lifestyle. So now I'll explain what are the risk factors for diabetes. Okay, so you can see from the slide, having a parent or siblings with diabetes, for overweight or having a BMI of 23 kg per meter, when you are physically inactive, smoking, have high blood pressure, having abnormal blood cholesterol, lipid levels, history of gestational diabetes, if you are 40 years and above, impact glucose tolerance or impact fasting glucose. I'll explain a bit on the weight, because the more fatty tissue that you have, the more resistant your body is to the action of insulin. And for inactivity, that means we are physically inactive. So physical activity helps us to control our weight. It uses up glucose as energy and makes our cell much more sensitive to insulin. Hence, it's important to have a healthy lifestyle to reduce the risk of developing type 2 diabetes. High blood pressure of greater than 140/90 mmHg is recognized as a risk factor for developing type 2 diabetes. Here are signs of symptoms of diabetes. You can see from the top, having a blurred vision because high sugar level swells up the eye lens. Feeling thirsty despite drinking lots of water. Excess water loses in tissues and body through passing of urine. Poor healing of cuts and wounds. High sugar level affects the circulation, causing blood to move more slowly. So we have a poor healing. Feeling tired, feeling hungry all the time, and losing weight despite of good appetite is because our sugar is unable to utilize for energy due to the minimal insulin production. For frequent passing of urine, because our kidney are working extra hard to filter and absorb the excess sugar. Feeling itchy, especially over the genital area, is because high sugar level promotes bacterial growth in that area. Now I will hand over to Rehal to present the next slide. Thank you.
Okay, hello. Thank you, Musin, for sharing the some of the diabetes things, like what is type 1 and type 2 diabetes, and also gestational diabetes. So now we'll be going through the screening of the diabetes and what is the typical treatment for diabetes and how we can take care of them at home. Okay, so basically, what do we mean by screening is that diabetes is actually a silent disease for us, and we can actually feel perfectly fine until complications starts to occur in our body. Then we will decide, okay, now it's time to check for diabetes. But then, however, this will result in a late diagnosis and a more serious irreversible complication that we will face at home. And this can be prevented through health screening. And this health screening will result us in getting early treatment and also the correct time to detect diabetes. So under the HPV Screen for Life program, they also do other chronic disease screening, and is recommended for those 40 years old and above, and it is done once every 3 years, okay, and through a blood test, fasting and non-fasting. So these are the different screening packages that we all have. So for Pioneer Generation people, you basically don't need to pay for anything. Then for Merdeka generation cardholder can be paying for $2, and Trust cardholder regardless blue or orange just need to pay for $2 as well, and other eligible Singaporeans to pay for $5 and PR $10. Okay, so what are the blood tests and how do doctor use to diagnose that if you have diabetes? So these are the 3 different type of blood tests that the doctor will use. So the first one, it is called the HbA1c blood test, where it gives an indication of your average blood sugar or glucose level over the past 3 months. So for this blood test, you do not need to fast on that day, means you still can eat as per normal on that day. Okay, so coming to the second blood test, fasting blood glucose test. This is a blood test usually done in the morning, okay, and it requires fasting of at least 8 hours before the blood sample is taken from you. So what this means that before going to the blood test, you need to fast, means you should not eat any food for at least 8 hours first before taking the blood test. Okay, and then the last blood test, which is the oral glucose tolerance test, which is a test consists of taking 2 sets of blood. Okay, so the first set of blood will be taken after you have done your 8-hour fasting. Okay, then the doctor will take your blood. Then after taking the blood, you are being given a sugary beverage to consume. Then 2 hours later, the doctor will take your blood again to check the difference and how your body is able to cope with the sudden surge of sugar in your body. So typically, with the random blood glucose check at any point of time of the day, if it is less than 7.8, then it is normal. But if you have a result of more than 11.1 or equal to 11.1, then you may have diabetes. Okay, and fasting blood glucose less than 6 is normal, and more than 7 is you are diabetic. So we also need to know the different complications that you may face if you have diabetes. Okay, so all these chronic diseases such as high blood sugar, high blood pressure, high cholesterol will all lead to blood vessel damage, whereby all your blood vessels are spoiled in your body. So in our body, we have a lot of blood vessels leading to the heart, to the brain, to the eyes. So if there's some form of damage in the brain, the vessels are damaged in the brain, then you will likely get a stroke. Okay, then if it is in the eyes, then the chances of getting blindness is higher. If it's in the teeth, then you'll experience tooth decay or gum disease. If the damage is in the heart, then you'll have heart attack. Then if the damage is in the kidney, then you'll have the risk of kidney failure. And if it is in the foot, then any sustained injury which the healing does not take place well may result you to an amputation. So what are the treatments for diabetes? So as we know, diabetes is a lifelong disease, and we need to control the diabetes in our body. So how can we do it is actually through good dieting habits and a combination of medications that the doctor has prescribed to you, and have to be compliant with the medication that is given to you to achieve a good outcome for managing diabetes at home. So how do we achieve our self-care with diabetes? Is that actually we need to take care of our food, okay, not getting injured easily, or if there's any dry area, to moisturize it and take good care of it so that it won't sustain any potential injury. that may lead to a potential amputation. And for skin care, make sure that your skin is not too dry. Okay, applying moisturizer to protect your skin so that it won't have any cracks or tears easily. And for dental care, to brush your teeth 2 times a day and also gargle regularly after every meal to ensure good oral hygiene. And for eye care, if you do have dry eyes, do hydrate yourself more. And if you are okay, it will be good that you can pop by the local pharmacies nearby your place and get some eye drop to hydrate your eyes. Okay, and how do we actually prevent diabetes from happening to us? Is that number 1 is that we should have a proper diet. Okay, then the sugar intake that through the diet we have will help our body to regulate properly. And do not smoke. Okay, because if we smoke, our vessels will also get damaged easily. So when our vessels are damaged in the pancreas, which produces the insulin, then the pancreas will not be able to produce enough insulin to regulate the sugar in our body, and this will cause diabetes to happen. And limiting your alcohol intake is as the same concept as not to smoke. And engage in regular physical activity is very important. This is to stimulate your body to produce more hormones, and also in a sense, in the pancreas, okay, your pancreas will generate more insulin to regulate the sugar that you are taking in. Okay, so question, how can I help my loved one live a healthy life? Can anyone share? I cannot hear it. Any more?
Eat healthy food.
Okay, can anyone share with me how can we help our loved one live a healthy life?
Eat healthy food.
Any suggestions?
Yes, I think Madam Go said eat healthy food.
Eat healthy food, very good. Anything else?
Tell them to exercise more frequently and don't smoke.
Excellent. Okay, encourage them to exercise more, very good. Anything else more?
No smoking.
No smoking. You tell them not to smoke, right?
Yeah, eat less sugary food.
Eat less sugary food. Okay, very good answer. Anything else? Any more?
Go for checkup.
Take medication regularly.
Take medication regularly. Very good. Okay. Actually, what you're sharing is all very relevant. So here are some of the discussion points that we have discussed together already. Cook and have healthy meals together. Walk and exercise together. Just now someone shared that point. Very, very good. Accompany your loved ones to medical appointments. Praise your loved ones for self-management efforts. Plan for social events around diverse activities. And pair healthy food with positive events. So these are some of the tips that we can help each other to live a healthier life together. Okay, so here are some of the short video clips from YouTube that shows that many different people from different walks of life has undergo this diabetes journey together. So some are through friendship, some are through support, some are through family love. So if you're interested at your own time, you can get your QR code scanner to scan this short video, scan this QR code, and you can take the video as a reference to how you can live a healthier life with diabetes. Okay. You all need some time to scan?
Is it possible to take a print screen of the QR code, then we can scan when we are
And
free?
also,
I don't know, mine cannot take it.
it's okay. We come back to that later. Okay, because
Okay.
I have a video to show everybody in my next slide.
Okay.
Yeah, I saw someone taking camera, but later we'll come back again.
Mm.
Okay, so this is our one of the videos that we want to show you, a journey with diabetes, a family love. So this is just a short video clip on how a family love supports each other where one of the family member has diabetes at home. Okay, so please enjoy the video.
Hey, I need to go toilet.
Any sound?
Sorry, Rebecca, do you mind adjusting the volume? It's slightly muffled.
Wait, sorry.
A short while, wait, I'll try to replay the video with better sound quality.
Okay. How is the sound? Better?
No, I don't think there's no sound.
Any? Is it okay just now?
There's no sound.
No sound. Wait,
Okay, while waiting for the video, I understand that some of you are looking through the screen for like the charges, right? So the charges is within $0 to $5. So like what the Benjamin has said, a blue and orange charge card is $2, but for green charge card is about $5. Mm.
Okay, can everybody see the screen? Okay, I'm gonna play the video.
When I was told I got diabetes, I really feel shocked because in our family we don't have anybody have a diabetes. So I'm very scared. I didn't realize diabetes have a degree of seriousness. Early detection will prevent my condition from getting serious. Once I confirmed diabetes, I need to change my diet. I cook differently. I use brown rice, I use oat, and cut down my sugar in my food. I learned how to balance my meal by using my healthy plate. The food is still so tasty.
When we go to the supermarket, I'll look for healthy alternatives such as oats. We eat the same snacks and fruits together. My mom just needs to be careful with her portioning. She loves to eat durians, so we eat durians together, but she limits her intake to just 2 pieces.
So during meal times, we will join her in eating brown rice, take plain water. We want to ensure that she feels included in the family activities, so that's important to us.
So day to day, I look for opportunities to chat with mom. I ask her like, how are you? If she's not feeling well, how's the cough? Show concern and to tell her that we're there for her. When she's trouble, we let her speak her mind and, and then we ask her like, what do you think you should do? And then as a family, how can we support her?
I will always remind her of her appointments, and I will also track her health results via Health Hub. When her blood test results are good, I will praise her and tell her that she's doing a good job. Because of her condition, she doesn't heal as quickly. So there was once she cut her finger, so I could rush down and make sure she's okay. Later I check on her to see that the wound is healing. We live quite near each other, so it's easier to be there for her in person. Because of this, my mom has now become an expert in healthy living. During a recent checkup, I found out that my blood sugar levels were on the high side, so she now reminds me to watch what I eat. I love desserts, so I have cut down a lot recently, and we are always learning from each other. It is helpful for family members to find out more about the condition when their family members is diagnosed. Mom was worried about gangrene, amputation and blindness. So through credible websites like Health Hub and other medical websites, I read that you can manage the condition better by taking steps towards a healthier lifestyle. That's when I reassure her with the information that I got.
It's important that the family comes together. So when my mom was newly diagnosed, we all came together as a family. We asked her how she felt and understanding what lifestyle changes she has to make and what support that the family can help her with. So these include treatment costs, her appointment dates, as well as how to work around her love for durian. So the family then planned on how we can support mom, and everyone contributes in their own way, depending on how flexible our working hours are, and as well as our financial ability. The important thing is we want mom to know that she's not alone.
Okay, hello everybody, can you hear me? Yeah, so just now is a short video clip where we can see that actually the family members are very strong knitted together. Even the family member even remind the mom to go and see a medical appointment and also give her a lot of support and encouragement. So it's important to show our care and concern to our loved ones, not only patients with diabetes, but other conditions as well. Yeah, so with that, do you all have any questions for us today? And here I will put the short video clips for QR while other people can ask the question.
Hey, thank you, Ray, Hao, and Shin. I think there's a couple of questions on the chat box, so probably we will go through that. So the rest can actually take your time to think if you have any other questions for the nurses. So our first question from Daisy is that is type 1 diabetes inherited? And also, can skinny people get diabetes? I think this is a very interesting question because a lot of people will always say, oh, skinny people are very healthy. So maybe you can help to debunk it for them.
Yes. I'll answer those two questions. Okay. So first so firstly, is that diabetes inherited? Okay.
Sorry, Moshe, you're a bit muffled.
Oh, yeah. No. Can
Try again.
can you hear me?
Yes, okay, it's better. Thank you.
Okay. Also, so as long as you have a family member that has diabetes, you are at risk of having diabetes. So, and then type 1 diabetes usually occurs when the pancreas loses its ability to produce insulin. So for those who suffer from pancreatic disease, yeah, they may have type 1 diabetes. Then for the next question, can skinny people get diabetes? yes, that doesn't mean you're overweight only then only you can get. So skinny people still can get diabetes. As I'll show back again the slide on the risk factors. Yeah. Okay, so as long you have under these risk factors, you are at risk of having diabetes. So as long you got history of parents, siblings with diabetes, if you are physically inactive, if you are smoking, if you have high blood pressure of more than 140 over 90, and you're 40 years and above, you are at risk of having diabetes. So doesn't mean skinny that you are healthy. Okay. Any more questions?
Okay. Thank you, Moshin. Yep. Regarding the child's card on the screening of the cost itself, like I shared earlier on, the cost is about $0 to $5. So for child's green card holder, your cost will be about $5 for the screen for live checkup. Okay. So for those who want to save the link itself for the short video clips that shared by Ray Hao and Mushin, you may actually take a screenshot also. Then you can actually take, or otherwise you can on your phone camera and try to scan this QR code. They will lead you to different links as well. Other than that, any other questions regarding today's topic?
Sorry, Felicia, just to add on. So if you cannot watch the video or you do not know how to access the video, you can always type the title below, Our Journey with Diabetes Unspoken Support, directly at the search tab of the YouTube website, and definitely you will find the video there. Yeah.
I would like to find out how to save this one in my YouTube video. How to save the talk? You all got this. Your talk is in YouTube, is it?
Our talk is actually at the Radima Silver Click Facebook, or alternatively, yes, YouTube. Radima's Silver Click also have a YouTube page, so you also can find all those videos that we have conducted previously in their both social media, Facebook, and also at their YouTube page itself.
But how to reach to the YouTube? What is the link to the YouTube?
Can, no problem. Just give us a short while. We will send the YouTube link over via the chat box, so you can actually click on it to save it.
Chat box is the must click the chat box. Then they got the YouTube.
The chat
YouTube series.
The chat box is currently this Zoom chat. Correct. Then we will post the information here. Then you can take a look. Just give us a short while. We will send it over. Then you see you can see the link or not, Madam Sharon.
Yeah, okay. All the chat is here. All the chat, all the chat is 15.
Yeah, I think you have not seen all the 15 chats shared by those questions and information.
What is that? What you say? 15 chat now. 15 Oh, got a link here. Oh, the link is here already,
Not yet, Madam Sharon. We have not shared. Just give us a short while.
Oh, okay, because I want to learn how to.
Alicia, you let me do. I do very quick.
I will place the link to your video.
Then, while waiting for the link itself, anyone have other questions? Anyway, from just now the video that Ray Hao and Mushin shared, it actually states that if you actually want to check your medical records, right, you can actually go to, if you are having any appointment at Sing Health itself, actually download the Health Buddy app. So you can actually take a look at your appointment and your test results there. Alternatively, if you are going to other hospital institution that is not within Sing Health, you can actually download the Health Hub itself. So you can actually take a look at your past vaccinations record and your results through the phone app itself.
Can I ask other questions? Is not on this diabetic one. Because I got this lower eyelid problem, or is an inward lower eyelid. So I need to go for operation. Meantime, I have this discharge. Is every morning I need, when I wake up, I must clean away the discharge. Then just now also have, so I must use my handkerchief, wet it and clean off. Is it due to the inward inward eyelid got the bacterial trap? What is it about? That's what I want to ask. Oh, the YouTube come already, huh?
Yes, Madam Sharon, the YouTube come already. Unfortunately, today's talk is about regarding the diabetes education series. So if you are staying near our community nurse post, or you are seeing our community nurse itself, perhaps you can actually check in with them regarding this question, or otherwise, if you have any appointment with the doctors, upcoming appointments with the doctors, you can chat with the doctors. But if you find that this eye situation is persists very often, right, we will suggest you to go and see a doctor soon. Okay.
I would like to know. Here got 2 YouTubes. Which one I should click? Here got 3. 3. How come got so many? Which one is the correct one?
Madam Sharon, so there are 4 YouTube page, 4 YouTube link. You can save all the YouTube links. They are all different videos itself, and one of the link is actually the Radima's YouTube page lah.
So
correct.
So I just click. Is it how to save? I don't know. I click the thing. Example. Is it?
Yes, you just click into the link itself.
Click the link and then see what happened.
Then
how
you
come got Health Hub program 61 scripts for life? The first Health Hub SG program is what? I think I YouTube then right, Then I see what?
You can
I
try
see
an error. That's right. Okay, so Madam Sharon is trying all her YouTube links. Anyone got any other questions?
No,
you can actually turn on
question.
your mic also if you have any questions. Just now I saw one. Yeah, actually, Madam Ma, just now I saw you raise your hand earlier on. You got any questions? Don't have. Okay, no problem. I think before that, while waiting for any questions, right, I will get Radima's side to actually share a QR code for you all to scan your passion card points first. Then along the way, if you all have any questions, then you can on your mic to check in with us.
Actually, your talk is what title?
What do you mean passion card points?
Hello, your talk is journey with your talk is underwear.
I need to share screen also.
Just give us I will just give us a moment, for today's talk is about diabetes education 1. So for this regarding the passion card QR code, maybe Gary, you can share a bit more. So after that, we have another QR code to share with you all also.
Okay, yeah, this QR code is for the passion card, tap for more points. Just scan this QR code, enter your details, and then you just select the passion card that you use. Then within 3 days, they will credit the 7.5 tap for more points into your passion card.
How to do it? Can you say again?
You need to use a QR code scanner to scan the QR code.
Scan and then need to open. No, now I'm interested in the nurse talk. Which are the link? The nurse talk, the main talk. Because I got so many links.
Hey, hi, Madam Sure, you actually register with us for the health talk, right? You sign
Yeah.
up through our form entry. Then okay, we will have your number. Don't worry, I will drop you a text itself regarding all the links. Would that be better to prevent any
all the links
confusion?
ah.
Yes,
Yeah,
correct,
yeah,
Madam
yeah.
Sharon. Can I will drop you a WhatsApp with all the YouTube links. I
Ah,
hope this
one
helps.
app ah.
Okay.
Okay lah.
Okay.
Okay, in
Madam,
that case, hello, in that case, can you also WhatsApp me the link as
okay,
well as
can.
the
I will do
passion
a
QR
one-time
code?
off send to you also, Madam Neil.
Okay, thank you.
No problem.
Now you say the what
Hello, me too. Please send to me also.
And we
for
will all
more points.
WhatsApp you. Can.
Christina, huh? Thank you.
Now I would like to know. Gary says passion card tap for more points. How to tap? That one is the people's or must how to get a QR code.
The
how
QR code
to
is
turn?
on the screen.
I must return to the screen because I at the chat now. Chat now.
Gary, Gary，
Gary
就是我们拍什么？拍那个 QR code 是吗？
对，拍那个 QR code，用那个
这样
QR 扫 QR 码的来拍。
OK， 这样，之前几天我也是参加一个，我没有and 我现在可以 go back 去。
OK， 那个要当天扫描，要不然就 expire 了。
OK， 好，谢谢。
不客气。
Hello, excuse me. Since I'm using my phone to attend the Zoom, how am I going to scan using my phone? I'm in the Zoom, no?
You can
I don't know how to scan.
you can in that case you can screenshot the QR code first. Later open your QR code scanner. Some QR code scanner apps they allow you to scan from your gallery.
Oh, okay. Scan from gallery, yeah. So that means I have to open the QR code and I scan from gallery. I got it from
correct.
gallery.
Yeah,
okay,
screenshot
thank
first.
you. Yeah, thank you.
Hello, will you please send all the YouTube address to us in the WhatsApp?
How come the passion card I scan already or they said continue so I must tick that one then can continue. Then put my IC
Yeah, put your IC.
First time I know. Is it the first time one or already have this one don't have so like that So what will happen my passion card will get more points
Yeah.
7 points Select your passion card I don't know how to do. Select your preferred passion card submit
Yeah, just type the passion card that you're using and then you press submit.
Oh, this one
I can see today got a lot of QR code for y'all to try. Today got 6 QR code for y'all to scan.
Thank you for your participation. You are currently verifying your participant.
Yeah.
Then they say click here to tap 4 more points.
Yeah, so done already. So in a few days they will credit the points.
Points. The points is and then no passion card click here. Right? For every $1, what is the thing I also don't know. Tap and earn the points. Then they got one no passion card click here. What's the thing? I got passion card
Then you don't care about the no passion card
don't care
Gary， 那个 passion card 给我们 point 是做什么用？
那个你要那个是分数咯，那个 passion card 的 point。
你们去 Giant 买东西也可以用你的 passion card 来扣。
We must tap our passion card number. They got a tap for more point and then passion card number. Is it
Tap for more point, tap and earn points.
Is it Gary? Hello, Gary.
Yeah, you see your passion card, then you just select the passion card and press submit.
Then how come that I scroll up then they say tap for more point. Check your tap for more point here. Enter the 16 digits. scan
That one is separate
number.
already. Once you press submit, it's done already. Don't need to do anything more.
Oh, okay. Thank you. I so lost already. Oh, yeah, lah, okay already. So when can know the point? How many days?
3 days.
3 days. Okay. Thank you. Wow, so special one today.
Okay, thank you all for your attention. We have one more QR code for you all to scan. My colleague Ray Hao already share on the screen itself. So we would like to actually have all your feedbacks as well regarding our health talk to let us actually learn and also become better and share more interesting topics with all of you. So if you all don't mind, can scan the QR code also or actually share the link at the chat box already. So you can help to click the link itself. Is the form.gov.sg, their website. So you can help me click in to help us fill up a few short questions so that all your feedbacks is actually all very important to us. So we hope that you'll be able to
I would like to find out. I would like to find out how come your the talk is always quite the same one. And got other sickness as well, like thyroid problem, and others, and then all the time I have this this YouTube for this diabetic, I think I ever talked before. You keep on repeating one, is it?
Madam Sharon, noted on your feedback, all our health talk topics are only once a year, so we don't repeat it the same for each year. So so for our topic itself, it's actually every year it will be sort of more or less reinforced to everyone again. Yeah, but we also have about 12 to 15 different topics on a yearly basis. So it will not be a repeated one. Don't worry. If no other questions, Ray Hao or Moshe, you all got any other advice or tips you want to give to our residents?
No more. I think we have very fantastic residents here, giving us a lot of attention and feedbacks. So hopefully you all enjoy the videos at home, and yeah, please attend our next health talk on the 29th of August. It's a Chinese version of the topic. Yeah.
Yes. Okay. Oh yeah,
Okay,
madam.
thank you,
Sorry,
everyone.
madam. I see you raise your hand. You got any questions or not? Or it's actually you are trying out the raising of hand icon.
Felicia, may I talk to you?
Oh yes, you may talk to me, Madam Christina.
Yeah, I tried to take the photos in the chat group for those YouTube, is it called address? But so confused because it jump. Do you mind send them to my WhatsApp?
Yes, no problem, Madam Christina. We'll definitely send to your WhatsApp together with Madam Sharon and Madam Neil, okay?
Because I'm not sure whether you just now I told you because it's of the interruption. I'm not sure whether you heard me.
No worry, Madam Christina. I hear you that you want the all the 5 links. I will send to you again. No worries. Once our health talk ends. So once again, thank you all, and thank you Mushin and Ray Hao for the sharing. So if you like to join us in our Mandarin talk, like what Ray Hao has shared earlier on, you'll be next Monday on 29 August at 2 p.m. Okay, I will see all of you next week. Thank you. Bye-bye.
Hello, wait, later then bye. Where's the WhatsApp you sent to me? I never see that.
Madam Sharon, I still here talking to you, cannot send to you now. I cannot multitask. You must wait for this health talk to end, then I can send you.
Oh, I don't know.
Excuse me, can you send to the Silver Click WhatsApp? Then everybody need to send it individually.
Yeah, Silver Click, reading.
No problem. I will send to Gary itself. Then Gary can help me to send forward to them.
Okay, thank you.
Thank you. Bye-bye.
Thank you very much.
Thank you. Bye-bye.
You talk already.
Bye.
Bye-bye. Thank you. Thank you for the talk.
Bye.
Thanks.
Bye-bye.
Bye.
Bye.